in this assignment. Before that, I want to introduce my friends are in this group. It is Aaron, Harry, Vaneetaran, Aidil, and me. Okay. The topic I want to present is smoke inhalation. What is smoke inhalation? Smoke inhalation is one of the dangerous diseases listed in this world. How smoke inhalation get inside our body? Smoke inhalation occurs when you breathe in the product of combustion during a fire. What is combustion? Combustion is result from the rapid breakdown of a substance by heat, more commonly called burning, or it also we do it by some irresponsible people that doesn't care about nature and people health. Smoke is a mixture of heated particles and gases like carbon dioxide, monoxide, and many more. It is impossible to predict the exact composition of the smoke produced by a fire. The product like trash, pepper or grass, big burn, and temperature of the fire and the amount of oxygen available to the fire all make a difference in the type of smoke produced. Smoke inhalation injury greatly increases the incidence of res- respiratory failure and acute respiratory distress syndrome. It is also the cause of most early deaths in birth victims. The mortality rate following smoke inhalation range from 45% to 78%. Okay, the next slide will be presented by Vaneetaran.
Hi sir, I'm Mazuan. Today I want to talk about signs and symptoms of smoke inhalation. We have four
Terima
numerous
kasih.
we have four numerous signs. The first sign is cough. The bronchospasm and mucus will increase. The respiratory tract get irritated. When we have bronchospasm, our chest will feel tight and we hard to catch our breath. When it comes to shortness of breath, the oxygen will decrease getting to the blood and it lead to inability of cells to use oxygen. Besides that, when it comes to noisy breathing, the fluids collecting in the upper airway. Lastly, because of the carbon monoxide poisoning, it will lead to headache. We have three signs that can determine the degree of injury. The first thing is soot, which is in nostrils or throat. It leads to nostrils and nasal passages swelling. Then our skin color turn into cherry red. Lastly, the changes in mental status is the oxygen level will low and it lead to confusion, fainting, seizures, and coma. We have three causes by smoke inhalation. The first thing is chemical asphyxiation. The compounds produced in fires can cause cell damage in our body by interfering with the delivery or use of oxygen. Example, the carbon monoxide, which is the leading cause of death in smoke inhalation. Besides that, the another cause is simple asphyxiation. The combustion uses up the oxygen near a fire, leaving you without oxygen to breathe. And Smoke also contains products such as carbon dioxide that cause harm by further limiting the amount of oxygen in the air. The final cause is irritant compounds. The combustion can cause chemicals to form that injure our skin and mucous membranes. This chemical can damage our respiratory tract, causing swelling and airway collapse. Example, the ammonia, sulfur dioxide, and chlorine of chemical irritants in smoke. The next slide will continue by Aidil.
We have two case reports which happened at Santa Maria, Brazil and Kampung Selamat, Pahang. As we can see, at the Santa Maria, Brazil, a tragic fire at a nightclub happened on the 27th of January 2013 in the city of Santa Maria at the Brazil. It includes 88 survivors that were admitted to the ICU with severe smoke inhalation. A total of death of 232 young people. The reason of death, smoke inhalation injury caused by enclosed space fires, which divided into direct thermal damage, carbon monoxide poisoning, and cyanide poisoning. And we can move to the Kampung Selamat, Pahang. A 74-year-old man died in a fire that broke out in his double-story bungalow on the 20th of May, Wednesday night. Subsequently, the body was found in a bedroom on the lower level of the house. At the cause of death, smoke inhalation and suffocation to save himself in the bedroom. So as we can see, they have both peaked because a fire incident. So at the diagram 1, it happened at the Santa Maria, Brazil, and at a nightclub in the city. And the right side at house in Kampung Selamat, Pahang, Malaysia. It have same incident that can make other people harm and feel uncomfortable. Right now, I want to talk about treatment. Firstly, oxygen. The most important part of smoke inhalation treatment is oxygen. It is administered through a mask, nose tube, or through breathing tube instead into your throat, depending on the severity of symptoms. Secondly, hyperbaric oxygenation that we call nickname is HBO. HBO is used to treat carbon monoxide poisoning. You will be placed in a compression chamber and given high dose of oxygen. The oxygen will dissolve into the blood plasma, so your tissue can receive oxygen while the carbon monoxide is removed from your blood. And thirdly, it is medication. Bronchodilators may be given to relax lungs, muscle, and widen airway. Antibiotics may be given to treat or prevent an infection. So, at the last treatment, it is at home. So, it will get a plenty of rest. Moreover, sleep in a reclined position or prop your head up with a pillow to help your breathe easier. And then, avoid a smoking or second hand smoke. Include things that may irritate your lungs, such as extremely cold, hot, humid, or dry air. And the last, carry out any breathing exercise as instructed by your doctor, also known as bronchial hygiene therapy. So that's all from our team. Thank you.